I think we're live. So what can I say? Welcome to the first episode of You Can't Handle the Tooth with the Floss Boss, Dr. J, like the real Floss Boss. So I'm gonna, before I get started on the subject for today, which is dental crowns, we're gonna try to hopefully get a little bit of feedback from anyone that is logging on at this time to watch, just to say it looks good, I'm in the frame, and you know, I want to make sure I've got it in landscape, which was kind of a trick to get done. But anyway, how's it looking?
Looks good.
I got Katie assisting me today. Say hi, Katie.
Hi.
And so I just ate lunch downtown at a place called Porcelain Pizza, where they make the pizza right in front of you, and it takes like 2 minutes to cook. It was delicious. Pizza's like my kryptonite and my protein. It's a horrible combination. Well, I want to welcome everybody to the first episode. This is a new series that we're going to be doing every Thursday at 3 o'clock. That's the goal, for every Thursday at 3 o'clock. So I don't intend to take too much time out here, but I'm going to talk a little bit about crowns. Before I start with any of these episodes, though, I have to say a couple of things that are important. Number one, none of these are scripted. I feel like that takes away from the entire concept of Facebook. I have no notes anywhere. I thought about doing that, and then I thought, well, that sort of defeats the purpose. So this is 100% raw, number one. Number two is I know that some of this this series has been shared across the country, and there's going to be some people who log in from other states, and I'm board certified in about 6 states, but even in those 6 states, you know, I've only taken a jurisprudence exam that legally allows me to practice in one of those states. And then there are a couple of states that just reciprocate. But in general, the point is, I haven't spoken to a lawyer, but there is a disclaimer I have to make, and that is, I'm not going to field questions, and the answers that I give are not going to be a diagnosis in any way. It's just going to be like a consult, and we'll talk about some ideas in general. This is not about my practice per se. This is about you, to help you answer questions that you might have and that you can take to your dentist who is treating you, and maybe you'll be a little better prepared for those consultations. Okay? So that's it. Having said that, the subject for today is dental crowns. Dental crowns. Have you noticed any feedback or anything?
Your wife.
I got one. That's okay. No problem. No problem. Hey, we all start somewhere. So we're going to talk about crowns today. And first of all, there's 2 types of fillings. You know, if a tooth is broken or decayed a little bit, then you get a filling. If it's broken or decayed a lot of it, then you end up getting a crown, which is a full coverage cap. We'll try to, I don't know how close I can get here and how well you can see this. Closer, I'm told to go closer.
Okay, back up a little bit.
Yeah, okay. So anyway, it's a full coverage cap. I'll show you a better picture of one in just a minute. But, and this acts sort of like a helmet that shields the whole tooth, protects it from breaking. All right, so that's what a crown does. The 2 types of restorations that can be done in dentistry, generally speaking, one is called a direct restoration, one is called an indirect restoration. And a direct restoration is the one where the dentist does in your mouth, on your tooth, directly. So most fillings are direct. Okay, so that means they clean out the cavity or the decay, and then they put the filling material directly into the tooth and make it. Whereas crowns and onlays, they are indirect, and that means the dentist somehow, and there's a couple of mechanisms to do this, will get an impression of your tooth, and on that impression outside of the mouth will make a crown or an onlay or a filling. Those are called indirect. So they're made outside of the mouth, and then you come back and they're bonded into place. All right. There's many different kinds of crowns. The oldest and still, which is a very good material, is gold. Most of America is very cosmetically oriented, and they are not interested in gold. We still do a couple of them every year because people really like them because that's what they're used to. And it is a very good material as far as the way teeth crash on each other. It's a kind material because it's softer. So for the very back molars, for someone that really has a big pounding, crushing problem, gold may be the best choice. And then they went through this phase where there was a lot of porcelain fused to metal crowns. And I remember seeing it. I don't know why people on TV, I noticed this on, but you can see that there's like these little black lines at the gum line where a crown is, and you're like, oh, those crowns are really ugly. Well, sometimes it's because there's metal underneath the porcelain, and the reflection of that metal coming off of the tooth root, you can see the metal, which is certainly silver and dark, and it comes off as this little black line up there, so they look like they're bad crowns, even though they may last 10 or 20 years. And then it started evolving into less and less metal. And so now, most crowns these days are done with porcelain. Some still use porcelain fused to metal, whether it's a silver metal or a gold metal. But a large part of the crowns that are made today are all porcelain. And there's different types of porcelain, even inside of that realm. So the traditional way that crowns get made is you get numb. The dentist prepares it, and most offices, I'm going to get to some data, at least from the city of Columbia in just a second. Most dentists, about 85%, at least in my city, still do it the traditional way. It's not a bad way, it's a good way. It's just traditional, and that's where you get a gooey impression made, and you have a temporary that's made, and then you go home while the crown, like we said, is indirectly made in the lab or at the office, however that dentist does it. And so then you come back for a second appointment, you get numb again, they take the temporary off, and they cement the crown in place. That is the way most of them are made. I talked to a rep. There's another way that they're made too, which is through digital dentistry. It requires some training, it requires some equipment that the dentist has to buy. And I asked one of the reps for this expensive equipment, I said, what's the percentage of dentists in Columbia that are doing it? And he said it's about 15%. I would have thought that number would have been a little bit higher. It's nowhere near 50%. But he said 15%. And then I said, of those dentists, because I know a dentist who has it and never uses it. And so I said, of the dentists that have this newer technology, how many of them are actually using it to its fullest extent? And he said, not many of them. I don't have a number for that, but certainly the number of dentists that are making crowns in a way that is digital is very low, probably 10% or so. So the way that it's done this way, so we've gone over the traditional way that they're done, and now they're done. Another way that they're done is by taking a digital impression. We call it a digital impression. So there is no gooey impression, but it's made with like a camera, and a camera goes on the teeth and just sort of does a little video of the arch that you're working on, of the opposing arch, and then of the bite. And then on the computer, the dentist can make the crown on the spot, and then wirelessly it is sent to a milling unit where out of a block of porcelain, the crown is milled, and then it's able to be cemented the same day. Now, those procedures, the traditional way, the first appointment's usually about an hour or an hour and a half. Second appointment's about a half hour, 45 minutes. And for the a little more modern way, which, like I said, they're both functionally great, so I would never say one way is better than the other. It's just different ways. But for the more modern digital way, a crown will take, I think on average, probably about 2 hours in an office from start to finish. But then you're gone, right? No temporaries, no second appointment or anything like that. So I thought I would take a minute and show you exactly, well, not exactly, but show you generally how one of these digital crowns are made. And then we'll take some questions if there have been any. I don't know if there are any. So, and it doesn't matter if there are any. All right. You want to go ahead and rotate this a little bit? And then go ahead and tap that little.
There's no button.
Oh, okay. All right. So, can you? I don't know if you can. All right, it's cool. So this is one, there are many systems out there. This system is called cerec, C-E-R-E-C. You can Google it. And it's basically a computer and also a digital impression maker or a camera. And then there's another unit that's the milling unit, and things are wirelessly transmitted to that unit. So basically, if you had a tooth that you were treating, you'd use this camera, And in the patient's mouth, it's all sanitized, so don't worry about that. But you would take the scanner and you just kind of scan the arch of teeth. You do the arch you're treating. They'll flip it over and scan the other arch. Then they'll have it together and they'll scan the bite. And the software is sophisticated enough to put all of those pieces together to generate your bite in a 3D fashion on the computer. And then the dentist will design it, and I don't know if you're able to see this pretty good. Does it look good? Mm-hmm. So you're able to, this represents, I've zoomed in, you can zoom in and out. But this is like the block of porcelain here, and then this is the crown that's in there. And what the machine will do is it'll use two burrs that come in and carve away all of this porcelain, and puts in, all of this anatomy in the tooth, makes it so that it fits the tooth that the impression was taken on, and then it's done. Then the dentist can take this crown out of that milling unit and take it to the patient and deliver it. So what's really interesting, though, is this way here, when they've done some studies on the integrity or the fit of this crown versus some in the lab, they are virtually identical. Very, very, very good restorations in both cases. So we're doing good? Mm-hmm. All right. That's kind of all I was going to cover today in the first episode. Any questions? Anybody have any questions?
Negative. We got great information, though.
All right. Well, I am going to sign off then. I want to thank anyone and everyone that's logged on for our first Facebook Live episode where we talked about crowns. We are getting some feedback on our Facebook page and through Instagram on some suggestions on subjects that you want us to cover in future weeks, and we're looking forward to doing that. So this will be posted, I think, on the Facebook page. Anyone can watch it later on. But I want to thank you for tuning in to You Can't Handle the Tooth. This is Dr. J, the Floss Boss, signing off.